Hello everyone, welcome to my channel Physiotherapy. So in the series of pharmacology, the next topic is dementia and its drug. So let's discuss about that, how you can write in university examination. So what is a dementia? It is a condition of mental health basically shown in geriatric patient which is declining their mental status and abilities to recognize any object, subject, people, and memory loss. Sometimes we have to and so on. So let's introduce about that. It involves a decline in the mental abilities you need to daily living develops when there is damage to the part of your brain involved with the learning, memory, decision making, and language. So what is the characteristics if occur in dementia? So memory loss, cognitive decline, impaired judgment, behavioral disturbance, and loss of daily functioning. So you have to solve this condition on the not only but basically into the in a wider range into the geriatric patient or old age patient. So, what is the types of dementia? So, primary type is to be brain disease. Example is to be Alzheimer. So, dementia is a wider term, and the Alzheimer it comes according to their type. So, Alzheimer disease is the uh, where we have to be shown the Alzheimer disease occur into the frontotemporal dementia. It occur where we have to be like loss of memory, cognition, attention, and reasoning power. So also known also have to be vascular dementia and mixed dementia. So these are the primary dementia where we have to be lost our memories, power, recognition, attention, and reasoning. So these two vascular and mixed dementia are to be combined and it just come occur into the primary dementia. Next is to be secondary dementia. These types happens from another medical condition that cause changes in your body include infection or alcohol related. If patient too much taking alcohol, their brain is to be like tired and has to be like unhealthy or unable to take a decision and memory loss. Also the impaired judgment will be occur if there is to be if you're consuming too much alcohol, and also there is to be infection will be occur after the any kind of open brain surgery and or like fracture is occurring to your brain. So this is the secondary dementia. Next is to be a reversible dementia. Some secondary cause dementia could be reversible from treatable issue like vitamin deficiency and medication side effects. So reversible dementia is to be will occur if you are in primary and secondary cases you have to be dementia has to be occur. But if you are in your adulthood age and all of the times you have taken the surgery like PT management and conservative management, so the dementia has to be okay and good and now you have to be recovered. But after some time you have to be old age, so dementia will be occur because there is a loss of bone health, vitamin loss, there is a nutrition into be declining in the old age, so dementia will be also regain into the reversible phase. So what is the symptom will be occurring to the primary, secondary, and reversible dementia? So let's discuss. First is cognitive symptoms. So difficulty to steering thought, memory loss, problem following direction, and trouble with language. So these are some easy peasy. So you can remember this. Next is to be behavioral and psychological symptoms which occur like agitation, disorientation, anxiety, irritability, depression, hallucination, sleep problem, paranoia, and fighting or repeating movement. Paranoia is it means like some people are not like hurting you but you feels like someone is hurting you, and all of the things is not like orientation way you have to be in into your desk, into your rake, into your bookshelves. So these are the symptoms occur into the dementia. So, what is the dementia cause in our body? The damage, dysfunction, and loss of nerve cells if you are not treated immediately, and their connection of the brain often linked to abnormal protein buildup. Misfolding of protein into brain get harm your brain neuron, cause neuroinflammation and vascular dysfunction and neuronal loss if you are not treated immediately. So that kind of causes it will be occur. Secondary cause if will be occur if you are sewing. So alcohol related Creutzfeldt-Jakob disease, which is a protein abnormal in fetal. They will occur into the fetus of the babies. Occur the Creutzfeldt-Jakob disease. Encephalitic occur, meningitis occur, multiple sclerosis occur, and traumatic brain injury will be shown, and Wilson disease. So these are some condition where dementia has to be caused. What is the risk factor where we have to shown dementia into the most? Where is it age related, family history, which is a genetic pass out, Down syndrome patient we have to shown, like high BP, high cholesterol, and diabetes patient will be our more prone to occur dementia. What is the common complication of Robinson? The bed sore. Why? Because dementia patient is to be more likely to be like bedridden. So because there is, if there is walking and doing something, so there is a disorientated and like misbehaving and like don't recognizing and like angry. So there is a bedridden patient and have to be on the bed sore. Dehydration and poor nutrition also will occur if their patient have to family condition is not well, and also there is a not taking care of ourselves, so that kind of condition is to be occur. Fall, injury or broken bones, so that some other condition is to be shown because patient has to be not recognize the steps, ladders and also the elevators, so there is a falling down and like injuries to be shown. Pneumonia also be shown because patient have to not feel like touch and pain and piercing on the time, so there is to be pneumonia as a most prone chance to occur. Like sepsis which also occur into the patient if there is a like too much surrounded area nearby the bacteria and virus. Dementia test, how you can recognize dementia. So blood test, CT scan, MRI, PET scan, spinal tap, lumbar puncture, and mental stress exam. So you can easily find it out. Dementia will be occur. What drug we have to be used, which is medication method or conservative method, you have to be given by the patient. First is the cholinesterase inhibitors. So it will be block down the cholinesterase, which is increase acetylcholine into the brain. So it will be promote acetylcholine and decrease the cholesterol. So drug name is donepezil, ribostimine, and gabapentin. So these drugs are mild to moderate, like Alzheimer disease used drug. And if you're taking long term this medication, so adverse effects happens on nausea, diarrhea, and body bradycardia, like occur. Like NMDA receptors and antagonist. Memantine drug block excitotoxic glutamate activity, which is moderate severe Alzheimer disease, adverse effects of dizziness and headache confusion. So these drugs are you have to be taken. So there is a chance to moderate dizziness and headache confusion will be occur, but it will be treatable into the Alzheimer disease. What is the physiotherapy goals to treat the dementia patient? To maintain functional independence, to provide like a functional training, home exercises to patient, improve mobility and balance, to balance control, gauze training, balance control, paddle ball, mirror therapy, and other training. Prevent fall, the patient gait training to prevent the fall, maintain muscle strength and endurance to enhance muscle strength to patient to walk properly, and reduce pain and stiffness to patient accommodate independently to perform any kind of several activity into the activity of daily life. Promote participation in daily activity, pain management, balance training, flexibility exercises, gait training, functional mobility, bed mobility, sit to stand, fall prevention program, postural management program, respiratory physiotherapy will occur into the bed ready presence. So that is the dementia. You can write on university examination for achieving a good marks. Thank you.